Hey everyone, this is Rick MacDermid with Senior Solutions Group, and been helping people understand Medicare and retirement starting in 1995, so that ages me a little bit. There's a lot of videos online, maybe hundreds or even thousands of Medicare 101 videos, Medicare workshop videos, and a lot of them can be, I'm guilty of this in the past, putting ones out that were like 45 minutes to an hour long. I'm going to try to keep it around 10 minutes today to give you an overview, 30,000 foot level bird's eye view of Medicare. So you can understand the nuts and the bolts without getting into all the nitty gritty, because most people aren't concerned about the nitty gritty. So what we're going to talk about is how Medicare works, what the different parts are, and talk about the different paths you can take. And then if you have any more questions, you can always reach out to us as well. And by the way, if you haven't subscribed to our channel yet, feel free to do so and share this with a friend. We also have Instagram and Facebook. If you'd like to join us on those two platforms, we are there as well. So there's two main parts to Medicare. I'm going to start with the alphabet soup, Part A of Medicare, which is inpatient hospital cost. So for most people that have Medicare Part A, there is no monthly premium. So the premium for Part A is zero for most people if you paid taxes long enough. Generally, it's at least 10 years of you or your spouse paying into Medicare. And if you get Medicare earlier than age 65, you won't pay a Part A premium. This is called premium-free Part A. A for hospital inpatient care. So what Part A will cover your hospital inpatient visit for a benefit period, which is 60 days right here. So you pay zero for your hospital stay for the first 60 days, except for a deductible. In 2024, the deductible is $1,632. Now, if you're on a Medicare Advantage plan, which is an alternative to Medicare, generally speaking, they will split this deductible up in 4 to 6 days, and you may pay roughly the same amount that you would pay under traditional Medicare for a 4 to 6 day hospital stay, maybe a little bit more, maybe a little bit less. But for people on traditional Medicare, you would pay $1,632 for the hospital. That does not include doctors. That's strictly the room and board of the hospital. Any procedures they perform in the hospital, such as surgeries, food, things like that. The day 61 through day 90 is going to be a $408 each day copay. And then days 91 through days 150, if you're unfortunate enough to still be in the hospital, it's $816 each day. That's over $40,000 that you would have to pay using your once-in-a-lifetime 60 reserved days that you can use once in your lifetime. The hospitals use a system called the DRG, Diagnostic Related Grouping System. So it depends on what you're in the hospital for. That is how the hospital gets paid. So if it's a stroke, a hip fracture, open heart surgery, the hospital will get a set amount of dollars from Medicare based on your illness or your injury. So the hospital has an incentive to discharge you as soon as they can safely, because they're not going to make any more or any less if they can get you out sooner or later. So if you have Medicare Part A, those are your costs for hospital. After day 150, you pay all the cost. So what is not covered by Medicare Part A? That would be private duty nursing, television in your room, cable TV, phone in your room. Most people use their devices anyway these days. And they won't cover a private room unless it's medically necessary. So that roommate of yours that's snoring too loud, guess what? You're going to have to get earplugs. The next thing we want to talk about is skilled nursing facility care. I used to work in a skilled nursing facility as a social worker, and in my college days as a CNA, Certified Nurse's Assistant. So when I was a social worker, we often talked to families about the cost of care and how expensive it is. Sometimes Medicare will cover up to 100 days in a skilled nursing facility. I had a client that his wife was talking to me today, and he's got about 2 weeks left of his 100-day stay due to his cancer treatment. So Medicare will cover up to a maximum of 100 days. Now, when would you need a skilled nursing stay? Typically, if the hospitals discharge you as soon as they can, let's say you have a stroke or have cancer, have a heart attack, you will get up to a 100-day maximum of benefit from Medicare, from the government. This would only be for a certain level of care after you've spent 3 nights in the hospital. You must spend at least 3 nights in the hospital. Now, we're trying to get that changed. During COVID, they took off the 3-day hospital requirement. So we're still waiting to hear from CMS whether they will remove that requirement or not. And the reason that is sometimes people will be in the hospital overnight for an outpatient observation stay. And that does not count toward your 3 nights. So you must be actually admitted by the doctor to have your 3-night hospital stay count. So once you're in the nursing facility getting rehab, in other words, you're getting better. If you have a stroke and they're able to give you therapy, if you're responding to the therapy, for the first 20 days, you pay nothing. Medicare pays 100%. From days 21 through day 100, you pay $204 each day. So about $16,000 would be your responsibility on top of the hospital coverage, the hospital costs, and the deductible. So the costs are adding up, and we haven't even gotten to the ER visit or the ambulance yet. That's what got you to the hospital. So then Medicare Part A will also cover hospice care. And again, this is right off the Medicare.gov website. So whenever you see Medicare.gov, you know it's the official site. There are some sites that don't use the word gov in it. You got to know those are more than likely marketing sites trying to sell you insurance. So these different components of Medicare, we talked about Part A, which is free. That's your inpatient part of Medicare. Part B would be your medical insurance. Often what people will do is they'll work past age 65 and then retire at age 66 or age 67, age 70, and you can delay your Part B as long as you have credible health insurance through your own employer or your spouse's employer without a penalty. If you do not have credible work insurance, then you will have to pay a late penalty if you delay your Part B enrollment past 8 months when your insurance from work ends. Now, the premium for Part B in 2024 is $174.70 each month, depending on your income. Most people pay the standard rate. People that pay a higher rate will have higher incomes. So those people will actually pay more for Medicare Part B based on their income. And they go back 2 years, the IRS and Social Security will coordinate together automatically behind the scenes. And if your income is above $206,000 in 2022 for 2024, you will pay a higher Medicare Part B premium, as well as a higher Part D as in drug premium as well. You can appeal that if you have a life-changing event like you got laid off from your work. They always go back 2 years, and this is your taxable, your modified adjusted gross taxable income that they base this off of, after deductions. But most people will pay $174.70. So in 2025, it may go up, let's say $10, so it might be $185 in 2025. We'll find that out in the fall. In 2024, you also have a annual once-a-year deductible of $240 before original Medicare starts to pay. So you only have to meet that deductible once a year, so it might be one visit to the dermatologist. That would satisfy your deductible. After you've met your deductible, Medicare will pay 80% and your responsibility is 20% with no cap, no out-of-pocket cap. So if you have traditional health insurance through an employer or through the marketplace, you would typically have an out-of-pocket limit. It might be $3,000, $5,000, $8,000, $10,000. Under Medicare, there is no limit. The sky's the limit. You could have $1 million medical procedure for cancer in treatment, follow-up treatment, and your out-of-pocket cost could hit $200,000. So what if you call 911 and have to go in the ambulance? What is your responsibility? Well, if you haven't met your deductible yet, you will pay 20% of the cost. What if you're airlifted? What if you're hiking? What if you're hunting? And you're in the woods and you slip down a crevasse and they need to airlift you to the nearest hospital? You're going to pay 20% of that bill. That's before you get to the ER. What if they don't know what's going on in the ER and they have to perform multiple tests? You're going to pay 20% of the cost of all those tests with no cap on those costs. That's before you even get admitted to the hospital. Once you get admitted, then you'll pay the deductible of $1,632 plus any copay that you have to spend if you're there 2 months or longer. What's a person to do? One option is you can, when you're brand new to Medicare, get what's called Medicare Supplement Insurance, also known as Medigap. When you're brand new to Medicare, within the first 6 months, you can pick any Medigap plan that you want when your Medicare Part B starts. B as in boy. So if you start Part A when you turn 65 and you work till you're 68 and you start your Part B at age 68, by the way, you want to enroll in Part B through Social Security, and there are multiple ways to do that. You can contact Social Security by phone, sit on hold for hours, go to your local office and sit there for hours, or you can create a login on Social Security's website on the government login site. Much quicker and much easier to do it that way. So a Medigap plan would be a supplement to Medicare. So if you think of Medicare as the truck, a Medigap is the trailer. When you connect the trailer to the truck by a hitch, that trailer is going to follow that truck wherever it goes. When it stops, the trailer stops. When it goes, the trailer goes. When it turns, the trailer turns. Whatever direction Medicare goes, your Medicare supplement plan is going to follow. With a Medigap plan, you can pick out a letter of the alphabet, letters A through letter G. If you're on Medicare prior to 2020, you may be able to get a plan F or a plan C, or you can get a high deductible plan F or a high deductible plan G. So the letter of the alphabet determines your benefits, not the insurance company. In a few states, like our state in Washington, you can change the paint color on your trailer without changing your benefits. So you can go from one company to the next company in order to save money, because there will be rate increases, usually on an annual basis. And we're seeing higher rate increases than we ever have before, especially since COVID ended and people are getting elective surgeries like never before. So we're seeing higher cost premiums on Medigap plans. Why would people pick a Medigap plan? Because they don't want to pay 20% of the cost of their care with no cap, and they don't want to be stuck with big medical bills, big hospital bills, big nursing home bills. So having a Medigap plan gives you peace of mind, knowing that you can go to any doctor that accepts Medicare and you don't need a referral. 98% of doctors nationwide accept Medicare. And a Medigap plan can never change your coverage. They can only raise your premium. So you'll never get a letter in the mail from your insurance company saying your coverage is terminating. The only time you would get that is if you don't make your premium payments. So you can keep your Medigap plan as long as you live, as long as you make your premium payments. And you can go to any doctor anywhere in the US that takes your red, white, and blue Medicare card. So the other part of Medicare, which is really technically it's not Medicare, it's an alternative to Medicare, is Medicare Part C. Now, Medicare Part C usually includes Part D drug coverage. When you have a Medigap plan, a supplement plan, you typically want to discuss with your agent or with your loved one if you need a Part D drug plan. We usually recommend it unless you have VA benefits and you don't really feel like you need drug coverage through a standalone drug plan. Now these plans are a standalone a la carte plan if you have traditional original Medicare with a supplement. You can get a Part D drug plan without a supplement, so you can just have Part A and B and a Part D drug plan. We usually don't recommend it. If you have any questions about that, feel free to reach out to us on that as well. So you may pay a higher premium based on your income for Part D as well. And we're expecting to see higher premiums starting in 2025, in part due to the Inflation Reduction Act. So with a Medicare Part D drug plan, that would only be used when you get your refills from a pharmacy, such as Walgreens, or through a mail order pharmacy. Now when you have Medicare Advantage, remember the truck and the trailer analogy? With a Medicare Advantage plan, you're disconnecting the trailer from the truck, you're unhitching that trailer, or if you've never had a trailer hitched up to begin with, you have your truck and you're handing the keys of your Medicare benefits to an insurance company who takes the keys of the truck from the government. The government hands the keys of the truck over to the insurance company and the government says, he's all yours, she's all yours, you are the driver. We are going to hop out of the truck and you drive the truck. Now we're going to monitor you. We're going to have a GPS tracking device to make sure you're behaving yourself. But these Medicare Advantage plans get paid for by taxpayers. So if you see that there's a plan that has a zero premium or a $20 a month premium or gives you a rebate, in other words, it pays you money back on your Social Security, which most plans don't do that. If you wonder how do they do that, that's because the taxpayers fund these plans. Also, you must continue to pay your Part B premium, the $174 each month, or in 2025 it might be $185, $190 a month, to be eligible for a Medicare Advantage plan. So what you're doing is you're giving the insurance company the permission to drive your Medicare benefit bus or truck. Is that better or is it worse? It really depends. Now, this is a CMS website, cms.gov. Again, it's an official website. Now, we'll see here that there are 67.3 people enrolled in Medicare as of April of 2024. We are in the month of July, the last day of July in 2024. So of the 67.3 people enrolled in Medicare, there are over half, slightly over half, almost 34 million people on Medicare Advantage, slightly over 50%. And there are 33.4 million people on traditional Medicare. So in our state, in Washington State, you can see there is a 49% enrollment in Medicare Advantage in the state of Washington. So we've got a lot of people enrolled in Medicare Advantage, and it doesn't mean it's better or worse. It's just the statistics are showing more people are enrolling in Medicare Advantage than ever before. If we look over at this chart over here, in 2013, about 11 years ago now, 71.75, almost 72% of people had regular Medicare. Now it's slightly less than half have regular Medicare. So we can see the trend. The purple is Medicare Advantage. Every year it's growing and growing and growing. There's a lot of push from insurance companies for Medicare Advantage, a lot of commercials on TV, a lot of mailers. There are phone calls, which are illegal in most cases. They are not supposed to be calling you, asking you to talk about Medicare Advantage plans without your explicit permission. So be careful who you give your Medicare information to. If you get a call out of the blue, hang up. They're not supposed to be doing that. So you can see our neighboring state to the south of us, Oregon, has 55% enrollment in Medicare Advantage. We got Texas here, 54%. We're licensed in multiple states. Tennessee, 53%. Some of the smaller states, population-wise, Wyoming has 18%, and Alaska is at, I think, 1% enrollment in Medicare Advantage. So it's a little bit all over the map depending on the population of the state. The insurance companies like the big population metro areas. So if you go to some of these bigger metro areas, you'll see there might be up to 70, 75 Medicare Advantage options. People get overwhelmed. The average county in the U.S. has about 42 options to pick from. So it can be very confusing. When you're looking at Medicare Advantage, it's very important to really know what you're getting. Don't be sold on extra perks, the extra bells and whistles, so to speak. I would not pick a plan based on these extra benefits. We are seeing a little bit of shrinkage on these extra benefits moving into 2025. So when you look at a Medicare Advantage plan, you really want to determine if your doctor's in network and if you can handle the out-of-pocket expenses and you're okay with prior authorizations. So it's kind of like Mother May I. Anyone who, as old as I am, will remember the game Mother May I. Getting permission from the insurance company. The doctor can't just say, okay, you need an MRI, your insurance will pay for it. The insurance company has to approve it. Under traditional Medicare A and B, the doctor does not need to get that pre-approval from Medicare. So the doctor will prescribe it and you'll get the MRI. Under Medicare Advantage, there is a prior authorization process for most of these expensive tests and procedures. So just be aware of that. Also, if you sign up for a Medicare Advantage plan, right out of the gates, you have a once-in-a-lifetime, one-year trial run. So you can sign up for a Medicare Advantage plan one time in your lifetime, and if you decide, no, it's not really my thing, I would rather go on a Medicare supplement plan, you may not be eligible based on pre-existing health. Something to keep in mind. So Medicare supplement plans are good for people who aren't so concerned about the extra benefits. They would rather go to any doctor that accepts Medicare, and they're willing to pay a higher premium. So you might pay anywhere from $80 a month up to, for the most expensive plans, over $200, $250 or more per month for a Medicare supplement plan, and that does not include drug coverage. A prescription drug plan might be an extra $30 a month, depending on the company, depending on your medication regimen. So it's not one size fits all. We really need to customize this. So if you go to a doctor and the doctor says, you know what, I've got a tea time in 30 minutes, I got to get to the golf course. All of my medical books are on that bookshelf back there. Take a look through those books, and I'm sure what you got's in one of those books. Your doctor's not doing his or her job. So our job is to ask you questions, find out what your situation is, and our team of experts will help you zero in on what the right course of action is for you. For some, it might be Medicare supplement insurance. For others, it might be Medicare Advantage. So there are those that say stay away from Medicare Advantage. There's those that say Medicare Advantage is the best thing since sliced bread. You know, the truth's kind of in the middle. It really does depend on your situation. If we could design a plan that was a Medicare supplement plan that had some of the benefits of Medicare Advantage, that would be wonderful, but we don't have that. We can't have our cake and eat it too. So it's really important to really zero in on what's important to you. So if you have some questions about your situation, whether it's for you or maybe you're retiring in the next several months or maybe the next year, feel free to reach out to us at Senior Solutions Group. We're here for you. And again, share this with a friend. And if you haven't done so, please subscribe. Take care and have a blessed rest of your day.